I just heard from Cancer Care Ontario that the Mississauga Halton actually has the highest incidence of breast cancer in Ontario. But we have a 91.1% survivorship. My gosh, I think some of it's related to good screening, treatment, but what do we do with those survivors? They need quality of life. Tell me where it goes when someone is diagnosed with breast cancer.
Prior to 2016, patient referrals were received from family physicians directly to surgeons. Now we have changed things. The hospital has helped support our breast STAP program, which is a program where patients are automatically enrolled to see a surgeon. And so they have the ability now not only to expedite their imaging through this service as well, but to also have quick access to a surgeon for treatment.
The way it typically has happened in the past, the general surgeons that are performing the mastectomy would make a referral to a plastic surgeon. And after that patient is seen and a plan is made for what reconstruction they would be offered, there would be coordination between the offices of this breast surgeon and the plastic surgeon to do the operation and do the reconstruction at the same time. But we're trying to see if we can funnel those referrals through a centralized hospital program.
That sounds like a really difficult thing to do.
It is.
It is very hard to coordinate.
Yeah.
So we have schedules to coordinate. Sometimes we need a second plastic surgeon for certain reconstruction options. And all that work is currently done by our office administration, who spends hours coordinating patient cases and care. And
Yes.
it's a lot of work. So for patients who are coming who have a new lesion which needs to be further assessed, they will meet with our breast navigators, our patient navigators, and this is the room they will commonly be seen in. They'll be asked questions, and this is where they get all the information about what's the biopsy they will be having, how does that look like, what is a mammo biopsy versus an ultrasound-guided biopsy. And so they have someone that's guiding them through the whole process to show them how it's going to happen so they can have less anxiety when the moment actually comes. This is one of our mammography rooms. These are the machines that take the images, and we have amazing state-of-the-art mammography machines, thanks to our great donors. So this is an ultrasound machine. This is in fact one of our older models, and this is commonly used to further work up lesions that we find on mammography. And this is one of our older machines, which is soon to be replaced thanks to our amazing donors who are constantly contributing to the hospital and to improving our patient care. And this is one of our newer machines, which obviously you can see it's so much more portable, and higher quality imaging will be provided to radiologists.
Welcome to the Restore Me clinic here. We create a beautiful and relaxing environment, including soft music and walk through the woods to help people relax. I create 3D tattoos, sometimes with a nipple that's made, a bit like this example, and sometimes it will be the illusion of a nipple there, much like this example. This is silicone that I practice on. Here's the tattoo machine, state-of-the-art with a remote pedal here. You'll see all the inks there, all state-of-the-art inks, and the whole procedure takes 2 hours. So the patients who leave here are probably the most fulfilled people. In fact, many break down and cry for their whole several-year process of restoration through chemo, through multiple surgeries, and this is the final completion.
We've had such great support from our chiefs of surgery of the hospital. We started with the breast EP. It was a tiny little program. It's grown. The access has improved. The diagnosis has improved. And then with that came our improvement in our plastic surgery and our ability to reconstruct patients immediately. I would say we are very competitive with, if not at equal level with a tertiary care center in providing patients with breast reconstruction.
Yeah, I feel like I can offer patients the whole package now. We're gonna do your nipple reconstruction. These are your options. We can do a 3D tattoo. I can reconstruct the nipple for you and then refer you to Dr. Ginty. So it flows really well.
I've had people say I've uncovered my mirrors now. That's so tragic to hear. But at the same time, we are helping people survive a fatal disease, and we are treating them and helping them survive. This is no longer a death-sentence type of cancer, which I know as a patient. I mean, I am a brachycardian patient myself, so having walked that walk, yes, yes, I think we do remarkable things at Oakville. I agree with you.